Hey everyone, welcome back to another Intellect nursing video. So today's video, we're going to be pretty quick here. We're going to go over insulin, and we're going to go over the onset, the peak, and the duration of each. So with that, we're going to help you understand the differences between rapid acting, short acting, intermediate acting, and long lasting insulin. All right, so getting right into it, let's first go over the rapid acting insulin. So that could be your Lispro or your Aspart. Those are some common insulins that you'll see at the hospital setting that you'll be given to patients. So those insulins are meant to be given right before meals. So usually patients are on an ACHS schedule, so before meals and at bedtime. So as you can assume, this onset is the fastest of the other options of insulin. So this is why we usually give it right before they eat. And it's not something you want to give when they aren't eating for a while because it's so rapidly acting. So the onset is about 10 to 20 minutes. Once again, that is the fastest acting insulin that you can give. So once again, your Lispro and Aspart. So the onset is 10 to 20 minutes. The peak is about an hour. So know that the most aggressive effect that it could have would be within that 1 hour mark. And then the duration is about 2 to 5 hours. So its effect doesn't last that long. It's really there to give a very fast correction of the blood sugar. It's usually there to help compensate for meals that they're about to eat. So that way that patient's blood sugar doesn't go from 125, which is maybe the level that we'd like the patient to be at all times, right? But when they eat, it could go up to 300. So this is that insulin that helps maintain and keep it down at that level. So that's why we usually like to give it right before they eat. It's not an insulin you want to give if they're not planning on eating for another hour or two. So a key thing to remember for the NCLEX is especially that. If there is a patient who's not eating for another 2 hours and you have an order for Lispro or Aspart to give, well, you should question that order because you should be only giving that insulin right before they eat. Now, going into regular, or you could call it short-acting insulin. But this, a lot of times, is called regular insulin. So your Humalog R or Novolin R, so that R meaning regular. The onset for this is about 30 minutes. So it does still happen pretty quickly, but it's not as fast as your short-acting, which is about 10 to 20 minutes. So onset about 30 minutes. The peak, however, is not that hour like the short acting. It takes about 2 to 4 hours for it to have its biggest effect. And then the duration is a little longer as well. The duration is about 5 to 7 hours. And another key note that you'll want to know for the NCLEX or your nursing exams is that this insulin is the only insulin that you can give IV. So if there's an order that you get on your NCLEX exam, it says that it's going to be given intravenously and it's a rapid acting insulin, that is not the case. Regular insulin is the only insulin that is allowed to give through the IV. So sometimes when you have patients on insulin drips, for example, that would be your regular insulin. No other insulin is allowed to give through the IV. Now getting into your intermediate acting insulin. So this would be your Humulin N or Novolin N. So N meaning your intermediate. So that would be an easy way to remember. If you have Humalog R or Novolin R, that's your R stands for regular. If you have a Novolin N or a Humulin N, that is your intermediate acting. So this is something we usually give for patients who may not be so severe and need immediate correction, for example. It might be more of a maintenance thing. So you might not see this in the hospital setting that much. Now, you will see this especially out, for orders for home and making sure their insulin stays at a normal level. So that way they don't have such drastic peaks and drops in their blood sugar. So this is something that you typically don't see in the hospital setting because we do rely on quick fixes in the hospital. But you may see it every once in a while still, just to maintain maybe their home medications, for example. So the onset with this, it takes about an hour to an hour and a half. So when you give this insulin, it'll take about an hour and a half to actually start taking effect on the patient's blood sugar. And the peak is about 4 to 12 hours. So its maximum effect will take about 4 to 12 hours. So from the time you give it, it could be 4 hours, it could be all the way to 12 hours for its max effect. And then the duration is 24 hours. So when you give it, it has an effect for 24 hours. Once again, this is usually not the primary use or primary insulin medication that we'll give to patients in the hospital setting, at least. Sometimes it's mixed with regular or mixed with rapid acting insulin, but it's usually not its only source unless it's a patient who's just continuing home medications. Now, going on to the long-lasting, you'll definitely see this in combination with your rapid-acting or your regular-acting or your short-acting insulin. So definitely make sure you understand this one. You might see something called Lantus, which is the trade name for Glargine. That is the most common one. Think Lantus as long-lasting. So it kind of starts with an L, long-lasting Lantus. So that is a common insulin that you'll see in the hospital setting especially. So the onset for this is an hour. So it'll take an hour for it to start working on the patient's blood sugar. However, there is no peak. So there isn't a certain period of time where the insulin spikes the effect or it drops the blood sugar the most. It is nice because it sustains that gradual drop of blood sugar, and it's really good for those patients who do require just continuous need of insulin in their systems. So it's very nice when you mix it with those regular acting or there's short acting or the rapid acting insulins, especially because it helps keep that blood sugar at a lower level over time. And the duration here also lasts 24 hours. So you could always use flashcards, for example, for memorization, but you will need to know these for your NCLEX and your nursing exams. So make sure you understand the peak, the onset, and the duration of each one. All right, guys, that sums up this video. It was a pretty quick one. So make sure you memorize those, use flashcards, do whatever you had to do just to remember the onset, peak, and duration of each one, and know there are 4 types. Thank you all for joining, and see you in the next one.